Hey everybody, welcome to the show. We've got Dr. Jessica Drummond with us today. She's a founder of the Integrative Women's Health Institute, and she's passionate about empowering women who struggle with chronic pelvic pain conditions and hormonal imbalances. She does help female athletes, and she does a lot of work supporting women's health and wellness professionals globally. She's got 2 decades of experience working with women using physical therapy and functional nutrition, as well as teaching her colleagues from an integrative, evidence based, and conservative perspective. I was telling Marika recently about how Jess was on my course in Austin, Texas, and some of the experiences that we both had through that process. And we thought it would be great to get her on the show because Marika had a question, which was, why are new mothers tired all the time? What's this depletion, this whole needing to recover more? And so we thought we'll dip our toe into the integrative health side of things, and who better to ask than Jessica? So hope you enjoy the show, and here comes the usual bit about what's going on. Cheers. Welcome to the Women's Health Podcast. I'm Anthony Lowe, the physio detective.
And I'm Marika Hart from Herasphere. Together, we interview leading authorities and we answer questions and share our thoughts to provide the general public with the best quality information that we can find on all aspects related to women's health. Please remember that the materials and content on this podcast are intended as general information and they are for entertainment purposes only.
They're not intended to be a substitute for professional medical advice, diagnosis, or treatment. Now sit back, grab your favourite beverage, or do your thing, and enjoy the show. We've got my co-host Marika. Welcome again. Hi Marika, how you going?
Good morning, Anthony. I'm great.
Beautiful. We've got Elaine who's going to be helping us with the show notes. Thanks for joining us again, Elaine.
You're most welcome.
And of course, we've got Jessica. Jessica, thanks for coming on the show, and looking forward to hearing lots about what you have to say about postnatal, things like depletion, why people feel like they have low energy. This is certainly an area that I don't pretend to understand. I understand that it exists, but I don't have much training in the way of this. So I'm really keen to hear about what you have to say on that.
Absolutely. Well, thanks so much for having me.
Oh, it's a pleasure. Always a pleasure. Always a pleasure.
So, Jessica, just to kick off this talk, what would you say are some of the common complaints that women have in let's just say in the first 12 months postnatally, that is not so much from a musculoskeletal pelvic health side of things, which I know that you deal a lot with as well, but from the sort of, I guess, maybe some of the fatigue, exhaustion, things that maybe women kind of write off as being, well, I've just had a baby, my baby doesn't sleep very much, but perhaps there's something more to it.
Yeah. So really my journey into the world of nutrition and more integrative medicine from purely physical therapy really started postpartum, although I didn't know it until about 4 years postpartum, because that was my experience after the birth of my first daughter. I was really fatigued. I was getting every cold and flu, in the world. I had like 4 sinus infections. I had pneumonia or something like that at one point. And the answer was generally, well, this is what it's like. You've got a baby now.
You're a mom, what do you expect? Come on.
Like, what are you thinking? And I had a pretty uncomplicated first pregnancy. I worked as a women's health physical therapist. I was teaching mother-baby exercise classes right up until about 3 weeks before my oldest daughter was born. So, and I had a normal, healthy delivery. She was born at 38 weeks, but it was nothing premature. Everything was term, and we were out of the hospital in 2 days. As you are in the US. I don't know if it's the same in Australia, but
yeah, that's frequent.
That's standard. Yeah. And so initially I think you do expect that you're going to be more tired because the baby, is up off and on around the clock. And I had about I'm trying to remember how much time I took off from work. The other thing that happens in the US that's a little different, at least from Europe, and I'm not sure of what the standard is in Australia, but we're back to work at about 6 to maybe 10 to 12 weeks on the outside. 12 weeks is kind of standard corporate maternity leave. I was back teaching mother baby exercise and working part-time at about 10 weeks. So you're really working pretty quick. And so you don't have this opportunity to sort of sleep more during the day when the baby sleeps, that kind of thing. And then also if it's not your first child, a lot of times you have toddlers who are awake, during the week. So there is definitely a sleep deprivation component. But what I learned from my personal experience and then later through a lot more training and working with different patients is that for some women, it's a fatigue that's very deep. It's a different kind. It's not, I'm just tired. When you're tired, if someone gives you 24 hours to just sleep, like let's say, your partner takes the baby over one night, or your partner and your mother-in-law or something, or your mom or your friend kind of gives you like 12 to 24 hours to get a good sleep, and then you can sort of bounce back, right?
You feel a bit more refreshed and ready to go.
Yeah, you can sleep. Fatigue is really more where, first of all, it's hard to even sleep when you have the chance. Sometimes it's kind of combined with insomnia. And second, you could sleep and sleep and sleep, and it's still like an empty well of exhaustion. And so there are a couple of different reasons that this happens postpartum. One, I think, is just the nutrient depletion of postpartum. It's interesting. You actually need more micronutrients and even calories postpartum than you do pregnancy, because the physiologic work of breastfeeding requires just more physical energy. So assuming you're nursing, but I think
to interrupt on that, do you know approximately how many more calories you would need for breastfeeding?
Yeah, it's something like 300 more kilocalories a day.
Okay, and it's about 200 in pregnancy, is that right?
Well, it's 300 additionally postpartum. So I'm not sure I think it's about double what you need. Yeah. So about 200 additional in pregnancy, and then 300 on top of that.
Oh, even on top of that extra 200. So 500 on top of what you would be.
Yeah. It's something like that.
Mm-hmm. Okay. So it's quite substantial.
Yeah. So
be cutting your calories and trying to
right. And that's the other thing, like how quickly can you get back into your skinny jeans, right? Like, and that's the stupidest thing ever. So, but there's also a nutrient absorption challenge. Women are they're not chewing. They're not, a lot of times digestive function isn't optimal. They might have struggled with constipation or bloating or some food sensitivities. And I think the most common thing that isn't really talked about postpartum is that there's a change in immune function. So there's dominant immune parts of your immune system. Certain cells, TH1 versus TH2, are more dominant in different times in your life. So during pregnancy, to really simplify this to make it well understandable, the immune system is somewhat quieted. It's naturally suppressed, which makes sense because we don't want infection of the fetus, right? Because the fetus is half not you. And then postpartum, that sort of more pro-inflammatory part of the immune system is activated. And so it's a very common time for things like autoimmune disease to be triggered, like postpartum thyroiditis. And again, there isn't a lot of research on this, but I think this is also the time when it's risky to have viral reactivations. So for me, I think I had mono a couple times when I was a kid because I was a very high level athlete and I was kind of a type A stressor. I didn't even realize it. That's just how I lived. So I had mono twice in high school. And, at the time it was like, oh, that never happens. This is so rare, right? But now we understand that viruses really they're not like cured. They sort of just go into hiding.
American, what is
And
mono?
Mono is Epstein-Barr virus. And so
what do we call it, Anthony? We call it something different here, don't we?
Glandular fever, isn't it? Mononucleosis.
Glandular
yeah,
fever. Thank you. I was like,
mononucleosis. Yeah. Mm-hmm.
thank you. Just clarifying for the international audience.
Yes. So essentially what happens is there's these kind of big swings in natural immunity, which are exacerbated by any disruption in digestive function. Because if you think about it, internally, your small intestinal lining functions a lot like your skin as a first barrier for keeping things away from your immune system, right? And also, like, did you really chew and break down that food? Was there enough stomach acid? Did you have enough digestive enzymes so that by the time the food gets to your small intestine, has most of the bacteria that's on it? You know, none of our food is sterile, right? We just live in a bacterial environment, and that's perfectly fine. But most of it should be eradicated by the stomach, the acid in your stomach, and by the chewing process and by digestive enzymes. And then you have this lining of the small intestine that functions as another good barrier between food or anything coming in through the mouth from outside and your immune system. So this is a time when things like food sensitivities can be triggered, thyroid autoimmunity can be triggered, viral reactivations can be triggered. And so those are the key things that I'm really looking for when someone postpartum is excessively tired. And I think just a kind of rule of thumb way to assess that is, you know, if you're given a couple days off during the month to just really restore, someone takes the baby, you've got some support, you're able to get to sleep, do you feel better after you do that, or do you still feel pretty rough?
That was so interesting. I've been actually writing notes down as well, Jessica. One of the things that I think is really fascinating, I actually also see a lot of people with these random autoimmune conditions that show up postnatally. And Anthony, I'm sure you see this as well, where lots of new mums will say, oh, my knee's been really sore lately. And I'll always ask that extra question, are there any other joints that are randomly sore as well? Oh yeah, my fingers have been a little bit sore and I've got this shoulder pain. Do you want to talk a little bit more as to some of the other musculoskeletal things that you see that may be arthritic conditions that pop up in that postnatal period as well that might be related?
Yeah, well, certainly rheumatoid arthritis, psoriatic arthritis, which is an autoimmune related condition. You know, the research that I published last year was interesting in that I had a patient who had vulvodynia, which we don't normally think of as an autoimmune condition, but those of us who are pelvic health, you know, experts, I guess, see a lot of patients with vulvodynia, which is a very specific pain in part of the vulva, external part of the vagina. And when, again, this was a kind of patient that sometimes I would see their symptoms would get better in pregnancy and then get exacerbated postpartum. So similar to joint pain, and a lot of times these autoimmune conditions will be overlapping. People will have more than one. They'll have psoriasis on the skin. They'll have, you know, joint pain that's more rheumatoid than than more of like a orthopedic issue. So vulvodynia can be in that category. Endometriosis has some degree of autoimmune component. So what I did was I had a patient who had her vulvodynia quieted down that first about 15 weeks of pregnancy, and her pain was really down, but she had had terrible pain for years before that. And I said, okay, what I used to do is just say, well, hey, enjoy it, and then come back to see me in like 6 weeks postpartum when everything comes firing back, right? But instead, we took a very systematic approach to optimizing her digestion, talking about what I was kind of just explaining through there, like making sure her stomach acid was functioning, she was chewing well, her stress was good, her exercise was balanced. And then, you know, didn't just wait it out, like made sure she had a lot of nutrient sufficiency, that her digestive lining was healthy, that she was taking good quality probiotics, that we were really kind of amping up that interface between the digestive system and the immune system. And through, as long as I've followed her now, which has been about 18 months, her pain has never returned. So I think we have an opportunity actually in pregnancy to potentially prevent and maybe even use that immune shift to support, the quieting of autoimmune conditions. So if we see that in pregnancy, or if someone had it prior to pregnancy, we can utilize pregnancy to really optimize the digestive and immune functions such that, and then of course we have to maintain that, we're still eating really cleanly, we're still taking probiotics, all of that. But then postpartum, it's able to be maintained. So the most common symptoms are really going to be things like deep chronic fatigue. Sometimes that goes along with anxiety, because if it's a hormonal issue, which we can get into in a minute, but deep fatigue, skin breakouts, especially things like rashes, starting to be more food sensitive, digestive complaints, joint pain, any chronic pain anywhere, headaches, vulvodynia. Those are the things that I'm really looking for when I'm just in thyroid condition. Also things like colds, hands and feet, hair falling out. Some women do have kind of this transient period of hair loss postpartum that just comes back. But anytime I see that, I'm still thinking of this red flag going up.
That's really interesting. It's so the link seemed to be that the vulvodynia was affected by possibly things like digestion, hormonal influences, stress on the system triggering a pain symptom. Is am I understanding it correctly? And I'm happy to be the ignorant one in the room because
I really do think that vulvodynia is at least partially an autoimmune condition.
Wow, that's wow. That's really different, right? And you know that I like different. I'm okay with different. It doesn't have so I hear about these axes, right? Like the HPA axis. And to me, an axis is something that you move around, like we have an axis of rotation. Is that related to it? I don't understand the physiological nature and working of hormones and the effects of human physiology. It's an area that I can study and that I know that I'll get. It's just that it's not something I'm interested in, but I realize just how important it is. And
so Anthony wants the cliff notes, right? You want Jessica to give us the short version.
Tell me what this axis is.
Yeah, and I think that's a good question, and I'll admit, so I went to physical therapy school because you didn't have to take biochem. That's like the main reason I didn't go to med school, and which is ridiculous.
Oh, the irony.
Yeah, which is ridiculous because I literally do biochem like all day, every day.
It's why I didn't go do postgrad med. I didn't want to study.
So, yeah. Right. And actually, I don't at all regret not going to medical school because that's also just pure torture. But so I'm super happy with the career that led me down. But now I do a lot of biochemistry, and it is very important. And I think what's so interesting from a physical standpoint. So vulvodynia, as an example, is literally a very specific pain in the external vulva. And so it's pain on penetration, it's pain with wearing tight jeans, it's pain with sitting. Sometimes it's provoked, sometimes it's always there. So there's definitely a myofascial component, right? Because when we teach patients to learn to relax the pelvic floor, that's helpful. There's oftentimes a hormonal component because the pain can show up cyclically with the menstrual cycle. And I believe there's this autoimmune component. So, and it also may be that there are different presentations in different people, right? Certain parts of those three things may be more dominant. So let's go back to the hormonal axes. So hormonal axes can be involved postpartum in the sense that they're all linked together. So you've got the hypothalamic pituitary adrenal axis, which is essentially your stress buffering system. Starts in the hypothalamus in the brain, communicates to the pituitary gland, and then communicates to your adrenal glands, which are two little glands that sit on top of your kidney. And the main hormone involved in that axis is cortisol, which is a stress buffering hormone. And now norepinephrine and epinephrine if like cortisol's not enough to get the job done. Cortisol has a very intricate relationship with insulin. So it's very affected by blood sugar levels, and that's one way that we can kind of help get cortisol back in balance. Also, there's the hypothalamic pituitary thyroid axis, the HPT axis. And so, for example, cortisol can inhibit the conversion of certain steps in that HPT axis. So anytime there's a thyroid issue, oftentimes actually in Western societies, the most common thyroid issue is really an autoimmune issue. So it's not really that the thyroid is not functioning, it's that the immune system is attacking the thyroid. So, but even still, I'm always making sure that kind of the base of that pyramid is really the HPA axis, the cortisol stress buffering axis. And even below that, you could say would be just blood sugar balance and insulin. Then we layer onto that thyroid. Then we layer on the sex hormone axis, which is hypothalamus, pituitary, and then ovaries or testes. So postpartum, you have normal estrogen suppression when you're nursing, but you can also have the cortisol and the thyroid, or the adrenal and the thyroid axes, being out of whack. Like I said, postpartum thyroiditis can be pretty common, and there's a very relatively simple way to prevent that. There's some good data that if you just take 200 micrograms of selenium, starting preconception and even in the beginning of pregnancy through postpartum, the risk of postpartum thyroiditis goes down considerably. So sometimes it's just not being nutrient deficient. And, you know, people really are walking around nutrient deficient. Even female elite athletes are really not getting the level of micronutrients that they need. And then what happens is the baby is always the first diversion, right? So the baby's going to they'll start taking it out of your bones or whatever, the baby gets it first. So that's another reason moms end up depleted. So if you consider that stress is, at least our hormonal stress buffering system is intricately related to blood sugar, now consider what the average busy new mom who's probably working and has a couple toddlers eats, right? So you get up in the morning, you're exhausted already. So you start your day with coffee, which is like sugar. Just think of it as sugar. Coffee is just sugar. And then you add to that, right? There you go. You add to that a bagel or maybe a donut or something, a bowl of cereal. There you go. Everyone's drinking coffee. I forgot it's morning where you are. So we're going to walk through your day. Okay. So you have your coffee and your sugar bomb, and then, you know, the body, elevated blood sugar is a physiologic emergency, right? So the body is designed to keep that in check. Your insulin is going to respond to that so that your brain and heart can continue to function. So when blood sugar goes up, insulin, and after a while, the cells can't keep taking in all this sugar, so they become insulin resistant. And so then you get kind of, and when it does work, when, you know, the insulin really quickly gets that blood sugar back down, cortisol is designed to bring it back up. So all day long, there's this like roller coaster of high blood sugar. So you start your day with coffee and a donut. You have this crash again at like 10 o'clock where I'm hungry, I need a protein bar, I need a candy bar, I need whatever, I need a snack. Then that's because your blood sugar is dropping. If it doesn't drop, then cortisol is going to kick in and push it back up for you. And that's why there's an anxiety component to this imbalance, because if that's not enough, you'll also get a kind of a shot of epinephrine, norepinephrine. So keeping blood sugar in the tightest possible range is what your body physiologically defaults to. So insulin and cortisol act against each other to make sure that blood sugar doesn't go too high or too low. And so all day long, we're sort of in this up and down pattern. Coffee and donut for breakfast, starving at 10 o'clock. That's the term hangry. Do you guys use that at all? Like when people are like hungry, angry?
Oh, yeah.
Hungry, angry, shaky, crashy. That is your blood sugar going too low. Then cortisol is going to kick in. Then again, you're going to eat something that's probably carby because you have sugar cravings at the same time. Or at lunch, you just happen to eat like a bowl of pasta or a sandwich or something like that. And then again, too high, too low, just because of our normal diet. Now, that system is not designed to really work like that. It's supposed to happen a few times a year. Like, you know, if there's some kind of emergency, it's not supposed to be like up and down, up and down. And the other thing that makes it kind of go out of range can be stress. So again, if you imagine, like you can get this little burst of cortisol, you know, anytime your phone notifications go off, or like your toddler is standing on the dresser when you walk in, like, you know what that feels like, right? If you just kind of imagine you come out of the bathroom and your toddler is like standing in a drawer and about to spill something, there's this like wave of rush, right? That's the sensation of cortisol. Does that make sense?
Yeah, absolutely.
Okay. So, and that happens to us all day long. So between how we eat and our kind of daily stressors, you know, just news and notifications and things like that, we get these little bursts of kind of depleting hormones, because cortisol is a hormone that's designed to kind of break you down to utilize any kind of stored energy or emergency, like that fight or flight real emergency. Now, fortunately in women, we can buffer that stress response using kind of connection to other women. So it's really important that women postpartum have people, other women primarily, that they feel like they can connect with. And you actually have this physiologic risk when, let's say you try to join your neighborhood moms group and like you get sort of ousted for some reason. That's a physiologic risk. The body's like warning bells go off, because imagine if, you know, evolutionarily, you were sort of kicked out of the tribe with your infant, you know, you're in big trouble. Like you're probably going to starve to death, right? There aren't like other neighborhood groups you can join, right? So so it's important for women. Women have kind of a deep-seated fear of reaching out to connect with other women, because there is a hormonal fear of rejection. But if it does happen, when you find your tribe, there's some real benefit to that hormonally. It actually eases the stress response. You don't have as big of a cortisol response to stressors when you have a few women friends that you feel connected to, or
That
sisters.
is so interesting. Because I read something recently that was saying in terms of recovery from, I think it was recovery from breast cancer. And if you have 5 close friends, your chances of survival are, I'm making up the stats completely, Jessica, but you know, like 10 times higher or something.
Yeah.
And I reached out to a bunch of my girlfriends. I was like, you know, we need to spend more time together, and not just for the sake that we'll live longer, but obviously it has real health benefits. So I find that really interesting for the new mums, because I run postnatal classes and I try and get them all to, you know, hang around and have a coffee afterwards, or if they're feeding, just have a little bit of a chit chat. We do lots of partner work so they can actually have those conversations and get to know each other, because it's a bit like going on a blind date sometimes when you're a new mum and you're meeting other new mums and you're like, are they going to like me? Are we going to get along? Or are we going to have similar, you know, ideas about parenting or whatever? And it's a little bit scary sometimes.
Yeah. And that's really important, that bonding period where you feel like you've got someone. And it also is a big problem because many new moms are pretty isolated now, right? You're home, you're by yourself. Maybe you've got some connections online in a Facebook group or something, and that's okay, but it's not nearly as good as having actual people that you could call and connect with and sit on the floor and like play with your babies, you know. That makes a huge difference. And that's also one of the challenges for women who go back to work at 6 or 8 weeks, because, you know, you're back with your colleagues, and some of them might be women, some of them might be new mothers, but, you know, maybe not. Like, so it's challenging really finding that connected group. And it doesn't have to be a lot of people. 2 to 5 is about range, but just knowing that you could trust them, that you could, like, you know, sit there and breastfeed and hormonally cry and all of that stuff in their presence is really, really valuable from a health standpoint.
Just quickly, if I could summarize, because, you know, I struggle to learn this stuff. So if we could just summarize what you just said, there seems to be some layers, like you were talking about layers. And so you talked about blood sugar and I don't remember the other one, but blood
Cortisol.
sugar. Yeah, and that's the basic. Well, there's a bottom layer, and then there's the HPA axis, of which cortisol is a part of. And then you layer on top of that the thyroid, and then you layer on top of that the HP ovaries or the HP testes, like the sex hormones on top. And you seem to be saying that we really need to take care of that foundation, the fluctuations in blood sugar. Really, that hormonal system was designed for emergencies, and yet we seem to be putting ourselves through it 3 to 5 times a day, which creates a very stressful environment. And then one of the ways that we can counter that modern day cultural stress is human connection, which is a very big leap from this is physiologically what's happening with your hormones to, hey, human connection. You know, we come back to connection again, and you've heard me talk about connection. You know, where connection can actually even out the response of cortisol. Have I summarized what you've said so far relatively accurately?
Yeah, that's really true. And an important thing about the layers is that you can't really skip. Like, you can, I mean, let's say someone has low estrogen and, you know, thus they have vaginal dryness, right? You could give someone a vulvar estrogen cream. Like, you can replace it at the top level, but you're not fixing the root of the problem. And it's not to say that giving vulvar estrogen cream is never appropriate. Sometimes it is useful and it can be a good crutch, and sometimes it's the long-term solution, depending on the situation. But we don't want to start there. It's the same thing. Like, I can give someone Chase Tree Vitex as a way to stimulate their progesterone. It's an herbal supplement. But again, that's starting at the top of the pyramid. Much better to first think about balancing their blood sugar, thinking about balancing their stress. The other thing that's very important for balancing that HPA axis is maintaining a balanced circadian rhythm. So turning off, you know, ideally I wouldn't be actually I should be putting on my like blue light blocking glasses right now because it's after dark here, you know, things like that. Shouldn't be exposed to all the blue. Should be going to bed at a reasonable time. Getting up in the morning and actually going outside and spending time in true sunlight without glasses on. Because it's surprising, but if you start to think about it, like, we really are not outside much in the day. So it's not only that we're being exposed to blue light past dark, but we're barely being exposed to daylight during the day. And that changes the rhythm of cortisol, which does have this natural rhythm. It's also part of the problem why people have a lot of trouble sleeping, and postpartum or anytime, but definitely postpartum, because if you get up to nurse, you might turn lights on, you might check your phone. Like, one thing you shouldn't do when you're up nursing is start checking your phone. Like, just keep it as dark as you can. Really, these amber glasses are very helpful. I wear stuff like this for any overseas flights that I take. I wear it the whole time just to kind of give that system a break. And they have some, 2 of them on my desk, because they have some that are a little lighter so you can wear them during the day. So if you're in fluorescent lights all day long, like in an office or something like that, you can do that. But just don't, you know, even if you don't put glasses on, you just get up in the morning, you keep the lights dim, you get up in the night, you go and nurse. and go back to bed, don't like start getting on your Facebook groups. Like that's just a bad thing to do in terms of, because what that does is it immediately suppresses your melatonin production, and melatonin is required for sleep. So circadian rhythms, having routine, the brain and the bowels both like routine. So we try to get that as quickly as possible postpartum, but as much as the baby will listen. And then balancing the blood sugar, having some social connection, having some consistent movement as well, which is important also for digestion. And then you can start to layer on the more complex things like, gut and the right probiotics and, restoring nutrients. But you can do a lot of that just naturally when you get the systems functioning better. If the digestion is working, you don't need a lot of supplements because every time you eat vegetables, you're actually absorbing the nutrients in them. Does that make sense?
Oh,
Yeah.
100%. So, we all talk a holistic game, but what you seem to be saying is that we take care of the basics, we take care of our diet, our sleep, our exercise, minimize the stress on the body, let things even out a little bit first. Then when it comes to dealing with some of the top tier type things, you may need less intervention because you've got the support from below. Is that close?
Yeah, absolutely. And that's really, I think, the map to sustainable integrative healing. I think you can't skip the foundation, right? We can add supplements, we can add, manual therapy, we can do sort of like the analogy that you gave in the course I was with you a couple weeks ago, where, you're holding onto the mountain, you got the baby over here. Sure, you can massage the neck all you want. And it's the same thing with the pelvic floor too, for sure. Same thing with your knee joint, you can massage that all you want, but if you have, 15 HSCRP, like if your inflammation internally is like through the roof, that massage is not going to last. The manual therapy that you could do a grade 5 manipulation. It's going to be okay for like a few minutes, but it's not going to be sustained. So it's really the same thing with an autoimmune condition. And a lot of these autoimmune conditions have myofascial and musculoskeletal symptoms. But if we treat those symptoms without restoring the baseline foundation of, I think of these truly as like health skills. Really, everybody needs them for everything, right? You need to know like what your bedtime rhythm is. You need to know how to keep a pretty consistent sleep schedule. You need to know how much exercise is good for you and how much is too much and how much is too little. Like these basic foundational skills, vegetables, digestion, water, we skip that and then we try to intervene with herbs and complicated manual therapy techniques and medications and surgeries, and none of it works as well if you skip the bottom.
Oh, spot on, Jessica. That was a great summary. I was just going to ask something. I've had a little mental blank. Hang on. Oh, blood sugars. So you talked about blood sugars and these sort of spikes and troughs that we go through over the course of a day, where our body is basically just trying to level stuff out and we keep throwing things at it that it needs to respond to. Do you have any tips for mums? So let's say we've got a new mum who is already pretty tired. What would you suggest is a good way of getting that good nutrition into her that's not going to make her blood sugar go crazy? Let's for example, let's start with a breakfast. What would be a good breakfast idea that's easy to prepare, that will help support her for the first half of the day?
Yeah, and I actually think breakfast is the key to healing this in terms of fatigue, because you need to start the day with that solid foundation so you're not craving the snack. It sort of spirals into each other, right? So omelets with vegetables, or even just literally like scrambled eggs with vegetables, like don't make it fancy. Like my daughter leaves the house at 6:45. So at about 6:20, I'm downstairs like throwing a few vegetables in a pan with some olive oil and like a couple of scrambled eggs and just smush it around until it all cooks and just give it to her, like that's an easy one. Another way to do that is to make muffins that are basically just little omelets, and then you can freeze them, and like baked eggs and other vegetables, and you could put some sausage in there or anything like that. So basically protein, vegetables, high quality fat is what you want at each meal. And high quality fat could be avocados, could be olive oil, could be nuts or seeds, things like that. Salmon, smoked salmon. So if I'm traveling, a lot of times I'll just buy like a thing of smoked salmon and eat that in the morning with like an apple and some peanut butter. Let's see. I also like dinner leftover for breakfast. So I know it's summer where you guys are now, so it's less appealing, but where I am, it's like 35 degrees, which is, I don't know what that is, Celsius, but it's zero. It's low.
Just over
it's,
0, 2 degrees.
Yeah. It's cold. So, I'll make like a big pot of chicken soup and just eat some of it for breakfast, or some kind of vegetable meat soup. Soup is good. And then for summer, smoothies are great. So you could do avocado, some protein powder, or the other thing I do is make like a couple of just sausages, like low nitrate sausage, just little breakfast ones, and you can heat them up in the toaster oven while you make a smoothie. And then just do something like avocados, some frozen berries. I have a recipe on my website actually for like the postpartum smoothie. It's basically avocados, some frozen berries, so it tastes like a milkshake, almond or hemp or coconut milk, something like that, and protein powder. And you could throw a greens powder, and you could actually put greens in it, or you could just, there's a lot of high quality like greens powders that you can just add, which are basically just dehydrated greens. So that gets you a quick kind of burst of
find out if we have them. We have them in Australia, Anthony.
Yeah, we do. They're expensive, but we have them.
Yeah. And I mean, if that's too expensive, you can take like any green, throw a handful of them in. So, and you can make that, you can kind of prep that stuff in advance. You could put some of the, like you could chop up the avocado and the berries for the week and just leave them all in separate little containers in your freezer and then throw it in the blender. So smoothies are good for that. I usually have a little extra protein with that. Those are probably my easiest breakfast ideas, either leftover dinner, some kind of eggs and veggies, like something like smoked salmon and whatever else you have around, or a protein shake with fat. So if you do protein, fat, and fiber, which is generally going to be vegetables, at each meal, you keep that really steady. And you'll also find that you're less hungry and craving and all of that. And it can be whole grains. We're not against any food groups here. There are some great high quality grains. So you could also do like a porridge with berries and nuts and seeds and things like that. But in the morning, I actually think that sort of old adage of like eat like a king at breakfast, and I don't know, then it gets less from there, is actually very sound advice when it comes to blood sugar balance. So protein, fat, fiber, which is generally from vegetables. The WHO recommendation for daily vegetable intake is actually 10 servings a day. In America, they suggest 5 because they don't think we can do it.
It's unachievable. No one will even try.
No. So when we like to win things, right? So we always just set the bar lower. But, so if you're going to do that, you got to start at breakfast, right? It's kind of like you can't drink all day if you don't start in the morning. It's like the same thing with vegetables.
My husband and I did like an elimination diet kind of thing. It must be about 8 years ago now. And of that for a month, we pretty much had exactly what you're saying. So some kind of protein, vegetables, usually cooked in coconut oil with some spices and things. When the month was over, even though we started introducing things back in, we never ever went back to having toast or cereal for breakfast ever. Because what we noticed was for both of us, that 10 o'clock, 11 o'clock dip, I mean, I don't get hungry till typically noon, maybe 1 o'clock for lunch. And we still do that. Not every single day, but most days it'll be eggs, vegetables, cooked in some kind of oil with some herbs and spices, and it really, really keeps me going. And I always thought for me porridge was so good because, you know, it was just one of those things that was advertised as being low GI and will make you last longer. But I was always so hungry by like 10:30 and craving the sugar high. And and I noticed that if I go back to eating porridge now, I'm starving by like 10 o'clock. I'm just like, give me something.
Well, and that's the gauge, because there is kind of a range of normal healthy diets, right? Some people actually do thrive quite well on more of a vegan, vegetarian, even relatively raw foods. It has to be, you know, vegetable heavy, but some people really do fine with like good quality whole grains. And that's the gauge. If you feel steady, like not hungry, not craving something, then whatever you had for breakfast was the right thing for your body. And I always say in my classes, like, eventually, if you do this for at least 3 weeks, you should literally be able to like get on a plane. Like now when I fly internationally, I pretty much fast. Maybe I'll bring a few nuts with me. I'll drink water. But you should be able to go, you know, 12, 24 hours without feeling hungry once you're entrained to this. And that's really important. That's a sign that your blood sugar is really stable. So during the day, every 6 hours is ideal. Because, I mean, you certainly can wait longer. Some people don't need to eat that much, but you do kind of need to eat 3 meals to really get all the vegetables in and just get enough nutrients from food. But your digestive tract is not designed to be constantly working all day. So every 6 hours is good. So it actually has like a rest in between. It's not really normal to eat like all day long, every 2 hours, little snacks here and there. So if I say to you like, hey, I've got a plane ticket to France, you know, we have to leave now and you can't eat. If you don't feel like you could go because you're like, what? I can't eat till I get there, then your blood sugar is not stable.
With my female power athletes, with my female competitive athletes, a lot of them have tried things like a paleo or a fat adapted diet, and quite a lot of them say that they don't do well unless they add some carbohydrate to supplement. What does the demands of exercise do to that type of diet? And I know that you're not cutting anything out. I'm just saying, what would be the considerations for somebody who's exercising every day for at least an hour, maybe 2 or 3?
Yes. In that case, and actually in any case where they're pretty active, for women, so a pure paleo and definitely a ketogenic diet is no grains at all. And a ketogenic diet is like not even really any starchy vegetables. It's very low carb. Generally speaking, I don't recommend ketogenic diets for athletes at all. Maybe men, it's a little bit of a different story. I'm not as well versed in men, so there may be some cases. For women, I would not recommend a ketogenic diet in general, other than a short-term period, like if they're trying to do a significant weight loss or something like that. For maybe, you know, you could do it for like 3 years, but not for an athlete. And if the only other time it's very reasonable to do a ketogenic diet is it's a therapeutic diet for seizures. So if someone has a seizure condition, it's a therapeutic diet. Now, paleo is a little step below that. So it's no grains at all. Like if you're doing pure paleo, no grains at all, but you could have more starchy vegetables like sweet potatoes and squashes and things like that. I find even for my active athletic women, high level athletes, that they can, again, do that to kind of get the blood sugar stable for a couple weeks, like maybe 1 to 3 weeks, if their blood sugar's been, if they've been carb loading for their whole career and so they're like have to make a transition, then doing that's helpful because it can kind of like cut all the cravings faster. But no, for most women, actually being no grain at all, I find is too hard on actually the HPA axis. It's physiologic. So you end up having, and the data shows that you end up having elevations in cortisol, which you don't want, because remember, cortisol breaks things down and it's inflammatory. It can be inflammatory. So for most women that are active at that level, there's one of two things that are more appropriate. For the heavy strength trainers, most of them tend to do better with animal protein, although there are a subset that can thrive on a vegetarian or even vegan diet, but most do better with animal protein, high quality fat, vegetables. And what I suggest is that they have whole gluten-free grains 3 to 4 times a week. So something like brown rice, millet, amaranth, buckwheat, teff, sorghum. There's all kinds of other grains. And the other thing you need from grains that it's hard to sometimes replace in enough volume without supplements is certain B vitamins. So I think for highly active women, most of the time their HPA is more balanced, they're more satisfied, they're less physiologically stressed with whole grain servings of 3 to 4 times a week, and maybe even a little bit more if they're doing like 3 hours in the gym. That might even be once a day. And I usually recommend that they do that in the afternoon, not like right at night and not first thing in the morning, because that's when they're going to burn through all that energy.
All right. But I was just sitting there thinking, okay, so maybe what if their experiences of trying to do things like that has come from not taking care of the bottom of the pyramid type stuff you've been saying before? Would that be also a consideration as to why previous attempts might not have been successful?
That's certainly also popular, but possible. I mean, it could have been that, they're not sleeping well, that they're not hydrated enough. It could be that their digestive function is off. So if they have low stomach acid, what if they've taken heartburn medication 5 years, or they just don't have enough stomach acid genetically. Certain genetic profiles have naturally more stomach acid than others. So if, for example, you have a blood type of A, it's more correlated to having lower natural levels of stomach acid. So then suddenly you do like a paleo diet and you're eating like hamburgers 3 times a day, which isn't the way you should do it, but this is what people do. You can't digest that, right? So you might be eating the food, but you're not actually absorbing it. So I will check that. Like, let's make sure digestive function is optimized, which means no bloating, normal Bristol 4 bowel movements once a day, things like that, because otherwise we got to address digestive function. And I'd certainly look at sleep, hydration, social support, daylight exposure, things like that.
I don't know if you had a follow-up question. Anthony, you have that puzzled look on your face. Can I ask Jessica a question? Or do you want to clarify that? You're on mute, by the way. We can't hear you.
Oh, sorry. Well, the computer just told me I was mute too. I did have that puzzled look on my face. So just really quickly, a little bit of fat, a little bit of protein, and fiber. Like, they were the 3 things that you mentioned a few times. So fat, protein, fiber, and fiber is usually going to be from the vegetables. And that seems to be the consistent thing through there. Now, I'm being selfish as well, because I'm thinking, oh man, I got to sort out my bottom of the pyramid, because I am the bottom of the pyramid at the moment. So, like, we're talking leafy greens, we're talking fibrous vegetables. Do you have any specific recommendations? Because otherwise people are going to do things like eat corn and carrots and sweet potato, and you know what I mean?
Yes. No, that's a very good question. It's funny. Sometimes I do forget. Like, I had a patient the other day who, when you eat this way for a long time, you live in a bubble a little bit. And I had a patient the other day who was like, well, I'm craving comfort foods. Can you give me some recipes? And I'm like, oh yeah, let's make like a nice beef stew, and we have Italian sausage soup. And she's like, no, she's like, I meant like cookies and lattes. And I was like, oh, okay. Change that. So, which we can adapt, but it's not quite the same thing. So vegetables, yes. So starchy vegetables, which essentially is sweet potato, squashes, squash, spaghetti squash, or you call them courgette, something like that. That is like the starchier vegetables. Still good, still full of nutrients, have some of that. What you want to have most of is the less starchy vegetables, which is leafy greens, mushrooms. All kinds of mushrooms are so good. They're also really good for the immune system. Asparagus, peppers, tomatoes. Tomatoes technically a fruit, but it's good. Onions, garlic, things like that. So yes, you want like the whole variety of vegetables. Corn is actually a grain, so that's not a vegetable. Potatoes are fine too for most people. Now, there's an interesting caveat. Nightshade vegetables can be problematic for people who have more pain, and not so much in rheumatoid pain, although it can be an issue. It's an autoimmune effect, has an autoimmune effect, but also even in orthopedic pain. So your patients who have more pelvic ring pain or more joint pain, not like more soft tissue pain or deeper pain, sometimes can be sensitive to nightshade vegetables. And those are your potatoes, tomatoes, eggplants. You can look them up, tomatillos, the nightshade family, and also peppers, which is kind of problematic, like especially when I was living in Texas, because you can't use like pepper spices like chili powder and things like that, hot red peppers. So one of my patients a long time ago, she was actually a physical therapist herself, and she had a spine fracture from a minor car accident. Later, they found out she was osteoporotic because she had celiac disease, and so she took out the gluten and finally able to absorb nutrients, but she still had this nagging pain in her back years later. And we took out the nightshades just for like a 3-week trial, which was really painful on her husband who loved to cook. And but they've since adapted, and that was it. Like just getting rid of that completely got rid of her pain. Now, that was a point where she had already done a lot of foundational work, but that's the only time that vegetables are an issue. Otherwise, all vegetables, lean on the less starchy vegetables. I'm not opposed to potatoes unless there's a nightshade issue, but more starchy vegetables, more or less starchy vegetables, and then more like the squashes and potatoes as support. Corn is a grain, so you have to count it with the grains, not the vegetables.
That's awesome. Jessica, you touched a little bit on sort of food sensitivities in that. I think one of the challenging things here in Australia, and maybe it's similar in the US, is that it's quite difficult to find people to actually either run some kind of testing or guide people through an elimination process. I do know there's quite a few doctors that I've come in contact with who really don't believe in nutritional health at all, but that's a whole nother story. What would be your recommendation for someone if they suspected they had a food sensitivity? What would be the best path for them to go down?
Generally speaking, the most evidence-based thing to do is an elimination diet. So for 3 weeks, I actually say 4 weeks, because it takes 3 weeks for the immune system to kind of quiet down, for all the antibodies to be reabsorbed if there are any floating around. So if you go for 4 weeks, with 100% consistency, the best you can, knowing that, occasionally there might be something that you didn't know was in your food or whatever, but just go for 100% consistency for 4 weeks, eliminating general elimination diet, but things. They can be fine-tuned, but like I said, like the nightshades are occasionally an issue. That's not something I would take out right off the bat, but if you eliminate dairy, gluten, sugar, soy, eggs, and peanuts, I would probably throw peanuts in there. And that's it for those 4 weeks. And you otherwise eat, a pretty balanced protein, fat, fiber plan that's vegetable heavy, but does have some animal protein, and you can have beans, that's fine. Nuts and seeds, then you should feel better after those 4 weeks. If you don't, there are things that certain people are unusually sensitive to. Things like nightshades, things like lectins, which are in beans. And some people need to have those cooked to really tolerate them well, or to make sure they're getting adequate digestive enzymes. Sometimes you just need to support digestion better. You know, we have to look at stomach acid, digestive enzymes, stress, chewing, movement. You know, did they have a surgery in their digestive system somewhere? You know, because there are complexities sometimes. For autoimmune cases, sometimes we do have to take the nightshades out. Sometimes we do have to take out things like nuts and seeds. But that basic elimination diet is a really good step towards knowing if you're on the right track. After that, it's really more evidence-based to work with a practitioner to start to think about fine-tuning. There are some lab tests that I do run. One is just kind of a general look at the colon, the bacteria in the colon, and if there's any inflammation there and things like that, and through a stool test. And there's another test that called urinary organic acid test that helps me to see if nutrients are being absorbed or not, or if there's like more nutrient deficiency. But food sensitivity testing, like IgG testing and some of the other like blood work you can get to look at food sensitivities, are notoriously unreliable. I think in context, like if you've already done an elimination diet, people have really cleaned up their nutrition. Like a lot of times on these food sensitivity tests, there's a lot of things that show up that are random. Like, oh my gosh, now I'm also allergic to blueberries and coconut. And like people get afraid of eating, which is unnecessary. The reason a lot of different things are showing up is because that barrier, remember we talked about in the beginning how the small intestine lining is kind of like an internal skin. The barrier is irritated. So anything that you're gonna eat is gonna be riling up the immune system, right? Because no whole chunks of blueberries are supposed to be exposed to your immune system. You gotta chew them. You gotta break them down in the stomach. The lining has to be intact. And if it's not, then your immune system is going to be kind of hyperreactive to a little bit of everything. And what I don't like about those tests is they begin to get people really afraid of eating, where what we have to do is nourish to heal. Like we have to be adding in this quality nutrition. So food sensitivity testing has a rare place when everything else is kind of being well managed. And there are the occasional outlier people who are sensitive to obscure things, but that's not the vast majority of the cases. So I do know, I'll see if I can find you a few people in Australia, and I know at least one great nutritionist in Australia and one in New Zealand, and they may have more local networks there. And a lot of kind of integrative practitioners do practice like this, but I would not, again, it's the same thing as like what we've been talking about the whole time. I wouldn't jump into a lot of lab testing. Literally, there are only 3 labs that I run on a regular basis. Stool testing, organic acids testing to see if nutrients are being absorbed. And there's a good kind of general hormone test called the Dutch test, which will give me some idea of what cortisol is doing, if someone's really low and all their sex hormones are really high in one, how those are being metabolized. That's it. And for a lot of people, I don't even do that until we've got the foundation set, because if you're running a lot of expensive, not evidence-based tests without having done the first core work, then you're going to get data that's useless. If you've done the work, then sometimes a test can be valuable to start, where should we go? Is there is there an underlying infection? Is there some kind of like mercury toxicity? There are these other physiologic stressors, but most of them are resolved by going right back to the foundation.
Some of the tests that that I've heard of just recently, because it was to do with food and gout pain, bad breath for somebody that I know, like a full GI panel, micronutrient studies, oral DNA, clinical chemistry, CBC, complete metabolic panel, testosterone, estrogen, inflammation, so CRP, ESR, uric acid, things like that. They were all, I think, expensive as well. And you're saying that before somebody runs off to do a big panel like that, it might be worthwhile taking care of the baseline first, and then you'd work into those sorts of things. Is that what I'm hearing?
Yes, to some degree. Now, there are some traditional medical tests that you mentioned in there, like the CBC and the HSCRP, or like whatever your version is of the inflammation test. Again, that can be just generally useful to make sure there's like no big red flags. And those in the US anyway generally aren't super expensive, because most of them would be covered if you had insurance, which, I don't know. That's a whole other conversation, but assuming you have health insurance. But even still, so let's imagine someone shows up in your office, they're 4 months postpartum, they're extremely fatigued, they're heavy, their hair's falling out, they're having anxiety, and their joints hurt. And I run an inflammation test. Well, I mean, it's probably gonna be high, right? Wouldn't it make more sense to set the foundation for a month and a half, unless you're just worried that there's some insidious, serious problem. But that picture is really common, and it's not likely. It was like a lot of my friends when I was in graduate school were a physician, trained to be physician assistants. And the whole motto of that program is like, don't look for zebras, treat horses, right? So what's most common? So first, let's have a conversation with this woman. What's her support network like? Is she getting any sleep? What kind of food does she have access to and able to cook? Can we help her cook in a way that's more sustainable? Does her partner or a teenage friend or someone, can they help her? Does she have time to go to the grocery store? Can she take her baby outside for a walk for 15 minutes a day? If we do these things for a month or 6 weeks or 3 months, and then if we still need to, if suddenly, first of all, a lot of the symptoms are going to be less, right? So we're like, well, we probably don't need to run that inflammation test because her joints don't hurt anymore. So that's my perspective. It's really the same as from when I was a physical therapist. I would recommend people back to an orthopedic surgeon to have an MRI done if my 3 months of back pain intervention didn't have, the prognosis or the changes weren't what I was expecting. Then it's like, oh, well, maybe there is something, maybe there's a bigger baby problem. Maybe there's a fracture there that we can't see or whatever. So that's the same way that I feel about running a lot of labs. I just think that it doesn't change what you're going to do from a treatment perspective. So it's resources, but more than that, it's people really afraid of the things that they probably are going to need to change.
That's great. I love it. Common sense approach, and simple, right? Simple. I was interested, when we did that little diastasis thing, and I was interested about changing your nutrition. I'm interested in this type of approach for people with pelvic organ prolapse, people with stress urinary incontinence, diastasis. We've already talked about vulvodynia, chronic pelvic pain, like endometriosis. How does this approach help those people who have traditionally been seen to have a structural deficit, not strong enough pelvic floor not attached, walls that that are being stretched out and pelvic organs dropping through, linea alba not having the tension and the ability to transfer load across it. How does this integrative medicine approach go with those sorts of traditionally structural diagnoses?
Yeah, well, actually, I learned a lot from kind of exploring that in my own body with you, and even actually since our last course in Austin, that there's a couple things. I think step one would be, let's talk diastasis first, because that's most obvious. First of all, if it's not truly diastasis, if it's really more just skin and fat, then I mean, you've got to lose that belly fat somehow, right? So that's step one, and that's really all the nutrition that we've been talking about, and mostly less carbs, less sugar fluctuations, definitely less sugar, caffeine, alcohol, things like that. But also what I've noticed kind of in my own body was that really interesting case that you showed where, you know, we had one woman who had a clear physiologic diastasis. You could kind of stick your hand in the space, right? Then you had the other woman who kind of didn't really look like she had a diastasis, but there's that kind of weakness in the muscle or in the fascia behind the muscle. Erin, I think was her name, if that makes sense, if you're remembering that. So what I'm noticing as I kind of go back and integrate that is that when you're bloated, you're going to be pushing into that fascia from an intestine standpoint, even if it's not a big split. It's just that the fascia is relatively weaker. Now, it may never really go back. I mean, the ability of the fascia to kind of restore all the way back to kind of its pre-pregnancy state depends on the degree of severity, right? But what I've noticed is that, if we take the bloating out, you don't have that constant pressure from the back. And so when you're doing all the myofascial strengthening and lifting and alignment and movement, you're having less pressure on the fascia just day to day standing up. And so everything else that you're doing is going to be restoring at least stability to some degree, if not actually changing the fascia. So I think from the inside, we can work on bloating is a key problem. We can work on any belly fat. Extra skin, I don't know what you can do there really. Probably not a heck of a lot. Also, and I think the same goes for pelvic floor. If someone just is carrying a lot of extra weight, or they're carrying weight and they're kind of contracting against it all the time, they're sort of like in that constant state of mild tension, then, you know, just healthy weight loss is going to be useful. Now, if you have like a pelvic floor muscle avulsion or something like that, I don't know that that's we can't really do anything biochemically there. You have to fix it. But the other thing biochemically is it takes nutrients to build collagen. So it takes protein, primarily amino acids. It also takes some cofactors like vitamin C. So I have worked with a number of like fitness professionals who maybe had a big diastasis their first pregnancy and kind of couldn't get back to that heavy stuff and then got pregnant again. But we kept them really eating cleanly. And again, it comes down to nutrient absorption, right? So if you can use collagen protein powder as a source of protein, or you can just eat meat. You know, you can do whatever you want. The amino acids are the same. They're a little bit easier digested in a protein powder, but assuming your digestive function is good, high quality animal protein or plant protein will give you those amino acids. You have the cofactors such as vitamin C through the vegetables and fruits that you're eating. Then you have the raw materials. So when your body is trying to heal those areas with collagen and, you know, bring blood flow and all of that, you've got the macro and micronutrients that you need for that healing. And I think that's really how we can support that in combination with the physical therapy work.
That's extremely fascinating, Jessica. It's very, very fascinating stuff. Um, there's much to think about, and obviously one of the questions that I'm going to ask is, how do I learn more about this stuff? How do, like, just assume I'm general public, right? How does the general public get information about this sort of thing?
Well, you can read my book. That would be a good place to start. We have a Kindle book.
You know you had a book. I don't have
I do. It just came out like 2 weeks ago or something.
I didn't know you had a book either. It's like,
Actually, the book launched the day of your course, so it was only like 2 weeks ago.
Oh, why didn't you say something?
Congratulations.
Well, I was learning. I didn't have any, but it's Kindle. You can get it on Amazon. That is a pelvic pain specific, but honestly, the story is the same. You've got to address the foundation. And when I've seen patients with diastasis address the foundation, starting from the beginning of pregnancy, and sometimes we miss in the first pregnancy because you don't know what you're in for the first pregnancy. But I think one of the great times that women can start learning about this is postpartum from whichever most recent pregnancy they're in preparation for the next pregnancy, or just in healing for good for themselves. Because what I do see commonly when people implement this during pregnancy is it's so supportive of their postpartum recovery. Like postpartum recovery is like built, it's sort of like, your competition is built in the off season, right? Postpartum recovery is built during pregnancy. And when women eat and take care of themselves and do all this during pregnancy, I've had a lot of my patients see other physical therapists because I work remotely. So, often I'm collaborating with people on the ground, and they're always saying that, their tissues are in better shape. Well, sure, because they've got the nutrients they need for the healing. So I think the pelvic pain book is a place to start, certainly if you have pelvic pain, but also just generally speaking in terms of setting the foundation. My friend Isabella Wentz wrote a great book on Hashimoto's thyroiditis. So that's the most common thyroid issue. So if you're struggling with anything thyroid related, it's a very similar approach for that. And I think really just focusing on the foundation, which ideally you'll be working with a nutritionist that has this approach. And there are, many of those people kind of scattered around the world. And we do have a directory on our website. So our website is Integrative Women's Health Institute. We've trained practitioners in more than 60 countries now. So we're starting to build out a directory of nutritionists and coaches and physical therapists who take this approach, and even some gynecologists, which is really exciting. So, and I think, certainly we're a resource. We have social media and things like that. And as you said, I'm the same way. Like, ask me a question. Feel free to send me a message. I will respond to you, or someone will on our team for sure.
Jessica, I'm really cognizant of the fact that we've had you for over an hour. Can I ask you 2 more questions?
Yes, you can.
You're allowed to say no. One question it's kind of a statement / conversation starter. A lot of women ask me, how long should I wait between children? And I know we've had a lot of information that's come out in recent years about postnatal depletion. And I do worry about the mums who have perhaps a stressful birth, and then they get pregnant while breastfeeding, and then breastfeeding while pregnant. And I do worry sometimes that women don't have that opportunity to restock, because you said babies will basically suck the nutrients out of your tissues, and without that ability to sort of stop breastfeeding, replenish, restock. Do you think that's a bit of a precursor to having?
Yeah, I think it's ideal to have about 3 months at least of real recovery. But, there are a lot of people who get pregnant and get pregnant again and get pregnant again who don't do it back to back, who also don't recover. So, you can think of this again. I like to think of pregnancy as again in sort of that athlete mindset, right? So it takes about the same amount of energy. It's a bit of a contact sport in delivery at times. And so ideally there's a recovery to every season, but sometimes that just doesn't happen for any number of reasons. So if you're fueling, you want to be even more fueling. You want to be even more sleeping. You're going to be integrating in the sleep, the hydration, downtime, restorative exercise, yin yoga, massage therapy, movement. You can't always be in like power training mode. And so for my athletes, we periodize that to the menstrual cycle to kind of take advantages of some of the highs and lows in hormone shifts. In pregnancy, you don't have that same shift, but yes, it would be more ideal to restore the nutrients, to get some sleep, to recover. But if you don't, you want to be fueling like you're, in competition. And that doesn't mean a lot of sugar. That doesn't mean a lot of calories. It means a lot of nutrients. It's a little bit more calories, but it's definitely a lot of nutrients. So that's the kind of person who's going to need some supplemental shakes, who's going to need some, to be eating like soup for dinner and breakfast. And, you can't fuel back-to-back pregnancies on coffee.
Yeah, I'm thinking about a boss of mine in London who was pregnant with twins, and she couldn't keep anything down. And apparently she could literally keep in her stomach was cookies, and she grew 2-3 kilo babies on cookies. And afterwards I was like, oh my god, like what is left within you?
Yeah.
Because she couldn't feel that. I was like, that's amazing that the babies can still manage to thrive.
Yeah, I mean, they take it from somewhere, right?
Yeah.
Now I would say that even my patients who are like awesome, they're fitness professionals and they're eating really well and they recovered postpartum the first time and we have them on the whole plan. Sometimes they have 3 or 4 months where they're puking the whole time, right? And so, or you're just nauseous and you can only handle whatever and you can't stick to that kind of less grains thing because it's the only thing you can eat. And I don't worry about that. I just relax through that. There's lots of other foundational things we take care of. You eat whatever you can tolerate. We try to keep it as nutrient dense as possible. Don't get stressed. There's an opportunity to recover. Make sure you're taking your prenatal vitamins and like blend things up and eat cold things or hot things, whatever works for you. We can make crackers out of almond flour. Like there's a way to adapt everything to make it a little more nutrient dense. But at the end of the day, if that's all you can stomach, what I would have done in her case is seeing if we could buffer that with some of the other foundational aspects. How else could we support her just recovery? But also I might have tried some more creative things. Like, could we get cookies that are more nutrient dense? I mean, you could bake them with nut flours, or you could add in some greens powder or protein powder, things like that. There are ways to kind of make anything you can tolerate a little more palatable.
It's like feeding your kids, isn't it? Like hiding as many vegetables and stuff as you can.
Yeah, it's like when you puree spinach and cook it into brownies and stuff. You could do that if you had to.
And I just have one last question, Jessica, and then I promise you I'll let you go. I just want to ask one question about exercise and cortisol, because I think mums, especially if they're in that weight loss mindset and will think, exercising, using Anthony's terms, the harder the better. There can be this mindset that if they're not losing weight quickly, it's because they're not doing enough. So therefore they need to do more. Did you have any thoughts about that?
Yeah. In my experience, they're actually usually doing too much intensity. So I have them ask themselves a question after their workout. Right after this workout, 2 hours later and the next morning, do I feel more nourished or more depleted? So right after the workout, sometimes they get that like runner's high and they're like, I feel great. And then like 2 hours later, they're like, give me all the cake and I'm starving and I'm hungry and I'm thirsty and I'm going to fall asleep. And then in the next morning, they're like, it was too much. So if they're in that like overtraining crash, cycle, then it's just too intense. It's far more important for cortisol balance to be relatively consistent. Certainly there could be a couple of rest days a week, but you want people mostly exercising almost every day, but not to the point of exhaustion when we're looking to recover from pregnancy and lose weight, because actually that will increase cortisol levels, which will have them holding on to belly fat. So you can progress, but be mindful of cortisol, especially if they've already had that deep adrenal fatigue. You've got to kind of recover the stress buffering system. Exercise is going to raise cortisol levels unless it's, restorative, something literally like in yoga, which isn't a bad thing from a transient perspective, but, and things like 10 minutes of heavier strength training is going to be far more valuable than like an hour-long spin class. Does that make sense?
Yeah, absolutely. So you would say to your clients, how do you feel in the 2 hours afterwards? How do you feel the next day when you roll out of bed?
Right. So right after the class, 2 hours later, and the next morning.
Yeah. Okay. Perfect. Thank you. I really appreciate that.
They're great questions to ask, and yeah, I got to up my game is what I'm sitting here thinking. You just triggered. I know that Marika said 2 more questions, but you just triggered another one in what you were saying. I do get asked a lot about exercise and conception, and does exercise affect IVF success rates? Does exercise affect getting pregnant the traditional way? Do you have any very brief words on that?
It can. If you have, again, too much intensity. So I'll give you an example. I had a patient who had PCOS. You would normally think more exercise, the better, right? It tends to be a heavier profile, someone with kind of pre-diabetes almost, so needs to exercise for the insulin sensitivity, improving insulin sensitivity. But she was doing like boot camp every day with like the guys from her office. She was working in like a really intense finance job. She was on. And in her case, both her PCOS, her insulin balance, her fertility dramatically improved when we weaved in kind of lowering the intensity, more, alternating it with more restorative exercise. There's a woman named Anne Domar who I think she works at Harvard now or somewhere in Boston. She's been studying essentially mindfulness, kind of like restorative movement practice with IVF for a long time. And it's not to say that people shouldn't exercise to get pregnant or if they're having IVF, because there's so many benefits of exercise from an inflammation standpoint, but it has to be not too much intensity. And so it may be every day, or maybe like 3 or 4 times a week doing like a longer walk, or even a lower intensity cardio workout, maybe 45 minutes on an hour or something like that. I'm still a big fan of relatively heavy lifting, like twice a week, but of shorter duration, because that's so good for insulin resistance. And that's one of the biggest problems when we're talking about fertility and hormones, because again, it's the base of the triangle or whatever you want to call it, base of the pyramid. And so, but it's that intensity. It's when people are doing boot camps and spin classes, or they're heavy strength training an hour or 2 or 3 a day, that could be too much, especially if they don't have the foundation in place.
Yeah. Thank you. I feel like we really have wandered, all over the place with this integrative health topic. I think I'm going to call the episode an introduction to integrative health because it's like scraping the bits off all the different topics and like, wow, I want to learn more about that. Wow, I want to learn more about that. So, look, there's so much that we would love to learn more, and hopefully, we can catch up again and touch on some more topics. Really, really enjoyed having you on the show, and really appreciated your time and your wisdom, and And catching up in person was fantastic, both in Melbourne and in Austin this year. So that was it's been great, and love your work, Jessica. And yeah, I don't know what else to say except thank you so very much, and for fitting us into your schedule.
Well, thank you.
Yeah.
Thank you, Jessica. And what's the name of your book again, just so people can find it?
Nutrition for Relieving Pelvic Pain.
And people can get that on Amazon.
Yeah, it's a Kindle book, but you can put a Kindle app on any device and just download it.
Yeah.
And we hope to have it in print in a month or two. Yeah.
Oh, perfect. And if people want to learn more, make sure you go to Jessica's website as well, the Integrative Women's Health Institute. And she has a very active newsletter, which you can sign on to. I get ones more for practitioners. Is it a separate one for general public? Do you have a...
Yes and no right now. It's a lot of overlap for everybody at this point, but we are steadily kind of segmenting that out. So but thank you guys so much for having me. It's been really fun. I always love, chatting with you. So yeah.
Thanks, Jessica.
Thank you very much. Chat soon. Well, that's it for this episode. Please be sure to hit like if you enjoyed this episode, and leave any comments or questions below, because we'd really love to hear from you.
If you haven't already hit subscribe, please do so now so that you can be kept notified of when we release a new episode.
Otherwise, thank you for listening, and we look forward to having you back with us for another episode of the Women's Health Podcast. Dr. Jessica Drummond is a passion... How about we start that again? So we thought we'd get Dr. Jessica Drummond, oi. So oi. Hey everybody, welcome to the show. Today we've got Dr. Jessica Drummond, who's the founder of the Hey everybody, welcome to the show. Today we've got Dr. pain conditions and hormonal imbalances, as well in helping... Hey everybody, welcome to the show. We've got Dr. Hope you enjoyed those outtakes. Make sure that you hit like or subscribe or both, and we'll get you some more episodes on the way in the new year. Cheers.